Mental health problems are very much like physical health problems, except we don't recognize them. And we do think there's something special, in a bad way, there's something special about them. But we just don't realize this simple fact that just like the physical health illnesses, most likely everybody, almost all of us, are going to get some kind of mental health issues at some point or the other. That is inevitable. And the question is, what do we do about it? In fact, the more important question is whether we even recognize it or not. Well, the good news is with growing education around mental health issues these days, we've been talking about it, and most people around the developed world, at least, they've been taking interest in it. And even in the developing world, people who can manage, those who have the resources and time at their hand, they are being aware about the whole thing. But the challenge still remains, and to the larger community in the developing world especially, we need to educate them, we need to tell people how much it matters. And one of the challenges that I see regarding identifying and recognizing the mental health issues is something that our ancestors faced many centuries ago. For example, when in earlier ancient times, when somebody was born with some problem in a body part, or let's say due to some accident they lost a body part, they kind of accepted it. They thought it was a part of their personality. And in fact, you would hear the stories when the first sort of artificial body parts, artificial limbs were brought in. A lot of people had troubles with it, and some people, out of their ignorance, they would feel that it would change them. They wouldn't be the same person. And that's the challenge right here when it comes to the mental health issues. That is, people identify it with their personality, their being. So for example, somebody who has a short temper, they think they are born that way and this is what they are. And if they are going to do something about it, they are going to change their basic nature. So that's the crucial bit, in my opinion, that we need to make people realize that what they think is a part of personality is not really the case. And their situation, as I said, is very similar to the person who had lost a body organ, probably a leg or a hand, and who was thinking that this is my personality and probably it is God's wish. But that's clearly not the case. So we need to talk about it, and we do need to read a lot about it to educate ourselves, and which is what we do in this podcast. We read books. So one of the series that I keep talking about is Oxford University Press. They have started this a very short introduction series, and in which they talk about depression. It's written by Mary Jane Tachi and Jen Scott. Both of them are psychiatrists, and they talk about depression. Although I would say that if you're going to read this book, it is going to help you with the literature part around depression, and not really help you in any other practical ways. So if you're interested in the literature aspect of it and just trying to understand the idea of depression, then it can be of help. So in today's podcast, I'm just going to talk about depression. At some point in future, I'm also going to talk about anxiety and other mental health issues. But let's start with the depression. What is it exactly? What does it mean? And why is it so hard to understand? And to uncover this mystery, I'm going to read a few passages from a book called This is Depression. It's a kind of a guide for you to understand depression. It's written by Dr. Deanne McIntosh, and I'm sure it will really help you understand what the depression really is about, because I feel there is lack of education when it comes to depression. So first of all, it's very important that we understand what is it exactly. So let's start. Depression is a highly personal experience. It doesn't just cause miserable emotional and physical symptoms, it also interferes with an individual's ability to function, whether at work, school, home, or in social situations. When you are depressed, just getting out of bed can feel overwhelmingly difficult. So, it is little wonder that performing at work, competing at school tasks, parenting effectively, or caring for yourself and your family can be difficult or even impossible. Furthermore, depression is a barrier to socializing with friends and participating in previously enjoyed recreational activities like exercise, hobbies, or going to the movies. In order to be diagnosed with depression, you must experience functional impairment, the inability to perform normal daily activities that are necessary to meet one's basic needs, fulfill responsibilities, and maintain health and well being. The Diagnostic and Statistical Manual of Mental Disorders, also known as DSM 5, is the most recent update of the manual that doctors may use to formally diagnose depression. However, past editions of the DSM have had some serious flaws, and the DSM 5 also has limitations. But you still need to have some framework. So let's see what DSM 5 says. To meet the DSM 5 criteria for diagnosis of major depression, one must have at least 5 of 9 possible symptoms. One of the first two symptoms must be either a depressed mood or a loss of interest or pleasure in usually enjoyed activities. The other 7 symptoms include alterations in sleep patterns, a change in weight or appetite, restlessness or feeling slowed down, fatigue, feelings of worthlessness or excessive guilt, difficulty concentrating or indecisiveness, and recurrent thoughts of death or suicide. So these are 9 possible symptoms. Keep in mind that when you consider all the possible combinations of these 9 symptoms, there are close to 1000 different ways depression may be experienced. And that's why it's no wonder so many people ask, what is depression? Because depression can look and feel very different for every individual. Most people think of depression only in terms of emotions. They think that to be depressed, one must feel sad or down. Yet, not everyone who is depressed feels that way. Some people will describe feeling nothing or numb. For that reason, a diagnosis of depression might include but does not require feelings of sadness or a depressed mood. So, that's where I think the author's point is very interesting, that the term depression, we relate it with the idea of feeling depressed or sad, but that may not always be the case. And in fact, sadness is an emotion, and often It comes with the clinical depression, what we talk about, but it can also come otherwise. So, how do we separate the two? And that's why we need to look at all these symptoms, spectrum of symptoms, all other combinations. At the same time, we need to remind ourselves that this DSM-5 module, it is not obviously covering everything that comes under depression. So sometimes it may happen that you do not experience these symptoms mentioned and still be depressed. And that's where it gets tricky. And that's why I'm encouraging you to read more on the subject and probably finish this book at least. Then there is another book called Unlearning Anxiety and Depression. It's another wonderful book on educating ourselves on this idea of anxiety and depression. But it uses a different approach. It not only educates you, but also suggests you ideas to help you go through depression or anxiety. So it's a kind of a self-help book and not just meant for the educational purposes. In fact, it is meant only to deal with these challenges. And throughout this book, you'll find some short notes after a few pages where they are trying to tell you what you can do about it, what could be the way to go about it, and how to deal with these different kinds of troubles. So as I said, depression could be of multiple kinds and could manifest itself in different ways. It could be because of a trauma. It could be because of a life-changing situation that you faced. Or it could not be that. It could be something that you haven't noticed and somehow you found yourself in this situation. At the same time, if you're trying to work on mental health issues, I would recommend that you try any kind of meditation technique which works for you. I did earlier a podcast on shamatha and vipassana meditation techniques. And soon I'll do another podcast on mindfulness and how to practice that. So I'm sure that will help you. But most importantly, I just want to tell you that all these mental health issues can be worked out. There's a puzzle, it can definitely be solved. It might take time, but there are ways to solve them. And whatever you're feeling at this point, I can understand, and nobody but you yourself can be the best judge of it. So eventually you will have to identify, experience, and understand it so that you can take the suitable steps. And even if you are not dealing with such a problem, we do need to realize that mental hygiene is just like physical hygiene. We need to regularly work towards it. We can't just ignore it altogether and wait for a serious crisis to occur. It is something that we have to continue practicing all along. So I hope you would do that. Thank you.